Welcome and thank you for standing by. At this time, all parties are on a listen-only mode until the question and answer session of today's conference. At that time, if you'd like to ask a question, please press star 1. Today's conference is also being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the meeting over to Ms. Portland Ridley. You may begin.
Hi. Hold on, please. I don't know what happened. I just said... Oh, dear. Yikes, I'm sorry about that. I don't know why it won't go down. Hold on, guys. Okay, I'm going to have to do that. Hello, everyone. Sorry about that. And welcome. And good afternoon, and welcome to today's webinar. I apologize. We had a slight start-up here with our slides. My name is Portland Ridley, and I am a project officer with the Suicide Prevention Branch at SAMHSA. And with me today are two other campus team project officers, Jennifer Capella and Rosalind Berlozier. They will also be presenting on today's webinar. Okay. This webinar is being recorded. The recording will be posted on the SPRC website through April 20th, and the link to the website is listed on this slide. So if you're a prospective applicant interested in applying for the Garrett Lee Smith Campus Suicide Prevention Grant, and you need some additional information about the application, then you are at the right place this afternoon. The purpose of this webinar is to provide you with an overview of the application submission process and to highlight important requirements. Please note that the content of this presentation is based on the content of the RFA package, which has two parts, and also on the content of the frequently asked questions document. We would appreciate if you would have these materials in front of you as we go through this presentation, as we will be referencing these documents at various times. In fact, you will find on most of the slides we have identified the page number or the section where you can find the information in the RFA. Again, this presentation is being recorded and will be available on the SPRC website through April 20th.
Okay, this is Roz Berlozier, one of the government project officers. And just a little introduction to SAMHSA. So SAMHSA is one of 11 operating divisions in the U.S. Department of Health and Human Services. And SAMHSA was established in 1992, and it's going to be turning 23 years old in 2015, kind of like our college students. So some of you may know SAMHSA through its predecessor, the Alcohol, Drug Abuse, and Mental Health Administration, ADAMHA. And the newly structured SAMHSA has 4 centers: the Center for Substance Abuse Treatment, the Center for Substance Abuse Prevention, the Center for Mental Health Services, which is where we work, and the Center for Behavioral Health Statistics and Quality, as well as 5 supporting offices. We are located in Rockville, Maryland, in a building that houses about 550 full-time employees and some contractors. And SAMHSA's authority is to serve as a contracting and granting agency. SAMHSA does not provide direct services. Our budget is an average of $3.3 billion, with 2/3 provided directly to the states through block grants. And only 1/3 supports the competitive discretionary grants, such as the Garrett Lee Smith Suicide Prevention Program in the Center for Mental Health Services. Now, in terms of the history of this grant, it was named for the former Senator Gordon Smith's son, Garrett, who died by suicide when he was in college. And since 2005, we have been able to fund grants on college campuses across the country. Initially, the grants were $75,000 per year, and more recently and currently, they're $102,000. And that is an annual funding level for 3 years, each of 3 years. So with this new RFA grant cycle, we anticipate about 20 grantees will be awarded in 2015. And you can, whoops, oh, I just was mentioning just the number of of grants that we've had. We've had 190 awards to 175 campuses to date. And that was because historically we used to, campuses were able to reapply, but that stopped a number of years ago. So just a point of information is this program is being announced prior to the appropriation for fiscal year 2015 for SAMHSA's programs, with the funding estimates based on the President's budget request for fiscal year 2015. So applications are invited based on the assumption that sufficient funds will be appropriate for fiscal year 2015 to permit funding of a reasonable number of applications solicited. All applicants, however, are reminded that we cannot guarantee that sufficient funds will be appropriated to permit SAMHSA to fund any applications. The award and funding details of this RFA are described on this slide consistent with the RFA. So you have the RFA, the funding opportunity number. The due date for applications is, I think, 11:59 p.m., April 20th, 2015, and the anticipated available funding is $2,007,000, and we hope to have about 20 awards, and each of them will be up to $102,000 per each of the 3 years. And there is a cost-sharing match requirement, which we'll talk about a little bit later. And please know that we remain hopeful that the monies will be appropriated for this grant program, but do understand the caveat. Okay. All right, so let's take a moment to talk about eligibility. Public, private colleges and universities, schools with religious affiliations, minority-serving institutions, community colleges, graduate and professional schools, as well as tribal colleges may apply. However, there are some limitations to eligibility. So, as I mentioned previously, entities that had previously been awarded a Garrett Lee Smith Campus Suicide Prevention Grant are not eligible to apply for funding. However, if a campus is a different institution but part of a regional system and identified as a different university, then an application can be submitted. So if the campus has received other SAMHSA grants that are not the Garrett Lee Smith Campus Suicide Prevention Grant, there are no restrictions. So even if you have been funded as part of a Garrett Lee Smith State Suicide Prevention Grant, that does not mean that you are ineligible. In other words, you may apply for the Campus Suicide Prevention Grant. Also, some of you may have been involved in consortia in your area. But if you are not the identified legally and financially responsible entity, then you are free to apply for a grant. And just a little comment about consortia, we just want to advise you to be cautious about the number of schools you would consider partnering with, because it just can become a challenge. So, in general, grants are administered out of counseling centers, wellness centers, academic departments, graduate programs, psychological training clinics, student organizations, et cetera, et cetera. Okay. So the purpose of this grant program is to help you develop a comprehensive approach to suicide prevention at your institution. We are encouraging you to consider a public health perspective in viewing suicide prevention as a concern for the entire campus community. In other words, suicide prevention is not just the responsibility of the counseling center. We surely understand that $102,000 will not enable you to do as much as you might wish, but it can surely help you get started in building the infrastructure for your programming. It doesn't matter if you are not doing anything right now related to suicide prevention. Just tell us what the needs are of your campus, what your plans are, and how you intend to use the grant funds to move these ideas along. So you need to assess or plan to assess your suicide prevention needs and develop an infrastructure so that you will have increased capacity to enhance and sustain effective prevention programs. In fact, SAMHSA's first initiative in the organization is the prevention of substance abuse and mental illness, which this grant addresses. Also, in this section of the RFA, there is a mention of special populations at high risk, the LGBT youth, American Indian, Alaska Natives, and military family members and veterans. Be sure to include some statements as to how you might specifically address the needs of these populations. And remember, This is an infrastructure grant, which means that funds cannot, I repeat, cannot be used to provide clinical services, and you cannot use clinical services for your match. Okay. So, going on. All right. In the RFA this time, these are called 6 required activities. But unfortunately, it was like a little hiccup. It sort of like slid through. We just want to make it very clear right from the start that you do not have to do all 6 of these activities. That in fact, you know, that could be, it would, for many campuses, that would be a huge burden. But so please just know that right from the start. And I know that it mentions it a little later in the RFA that, you know, you do not have to do all of these. So just don't get kind of caught up in the word 6 required activities. So some campuses don't have mental and behavioral health services or limited ones. And so this first activity has to do with developing a networking infrastructure to providers in the broader community. The grant funds can be used to develop the network, but not to provide clinical services. The campus should also have developed a crisis response protocol for students in distress and a post-vention plan for what to do after a suicide occurs. And this crisis response protocol is very important, particularly if you're going to expand capacity. You must be able to meet the needs of students in crisis. However, I just want to say the expectation is not necessarily that you're going to have all these crisis protocols and post-vention services in place before you start the grant, but rather you can use the grant, the funds, and the time to begin to put these services in place as you begin to consider some of the programming that you want to do. So, you know, don't be put off by this. The expectation, again, is not that you're going to necessarily have all of this in place. We have many campuses who, you know, have this as a major focus of their activity in the beginning of their grant. Okay, in terms of training programs for students, that's the next bullet. The grant allows for the development of training programs for students, faculty, and staff. We call these gatekeeper training, and they help instruct attendees on how to respond effectively to students dealing with issues that could lead to a suicide attempt or completion. These gatekeeper trainings must be available to the entire student body. Might be available, not must, to the entire student body or maybe to a targeted group, such as the resident advisors, first responders, coaches, student leaders, etc. And again, you know, that's for you to decide. So examples of some kind of gatekeeper training programs that you might have heard of would be programs that are like QPR, Assist, Campus Connect, or other programs that you may design yourself. Okay, in terms of educational seminars, these would be for students, faculty, and staff, and they might include providing information on suicide prevention, risk or protective factors, on promoting help seeking, and reducing stigma. And again, these can be educational seminars from other places or ones that you develop yourself. Okay. Linkages to the National Suicide Prevention Lifeline. So it's often too large of a task for a college to support its own crisis line. It's just, you know, too labor intensive. But promoting a link to the National Suicide Prevention Lifeline is certainly an encouraged, allowable activity of the grant. And in fact, many campuses connect up with their local crisis line, who often are members of the National Suicide Prevention Lifeline. And a lot of times campuses will do a lot of marketing with the National Suicide Prevention Lifeline as well as the local, but as well as the local Lifeline crisis center number on the marketing materials. Okay, and finally, developing your own or using materials that are already created to provide information to students, faculty, and staff that, for example, that address warning signs, describe symptoms of depression, promote health-seeking behaviors, and reduce stigma, and also to prepare these kinds of materials for family and friends. So we're well aware that you are highly sensitized to the need to present materials that are culturally appropriate for diverse populations. Okay, so again, as you know, I just can't make this clear enough. Again, please note that you're not required to select all 6 allowable activities. I mean, you can if you want, but that is not a requirement. It's just that you must work in the 6 areas. That's what has been legislatively approved. And of course, the activities you select for funding should be based on the needs of your campus.
Thank you, Roz. Now that we've covered information on what is allowable under this grant program, we're going to review some activities that are not allowed under this grant program. And there are several activities that are prohibited under this grant program. And one of the most common mistakes we see is when applicants propose to use grant funds to provide direct client-level treatment or clinical services. This grant program is not a research, fellowship, or training grant program, so funds must strictly be used for infrastructure development. So programming, funds to request programming for direct clinical mental health services, substance abuse treatment services, any kind of therapy, counseling, medication management, or the development of treatment plans is not allowed. On this slide, we've listed other funding restrictions. Again, another common mistake we see in this application is when applicants propose to use grant funds for scholarships, fellowships, stipends. Stipends is a popular method that campuses like to use as compensation for students or graduate interns who are working on the grant project. Please do not put in the word stipends anywhere in your grant. If you want to pay a student or a grad student for his services under the grant, just put their name and their hourly wage and the personnel costs. Just give them an hourly fee, a traditional direct wage model, and your personal costs as part of your staffing plan. Other non-allowable costs include curriculum fees and incentives for staff and faculty. However, we'd like to emphasize that incentives are allowed and encouraged for students to participate or attend in your outreach and educational activities. Non-cash incentives cannot exceed $30 per student. If you need more information on funding restrictions and non-allowable program activities, please see Part 2, Appendix D. Okay. As a reminder, I wanted to also just review the expectations of this grant. Again, this is an infrastructure grant, so there are essential capacities that campuses must have in place. Crisis response protocol, information and referral to adequate on and off campus services before adding new efforts. And of course, these can be developed as part of your grant-funded activities. It is not expected that your protocols are going to be fully developed and in place prior to the beginning of your grant. Campuses, I think what we want to emphasize here is that campuses need to have capacity to address student demand for services before any other activities begin, such as marketing. You know, you don't want to market all of your suicide prevention education activities and then you don't have the resources or capacity to address increased demand for services. So please make sure, if this is one of the areas that you want to fund in your grant, please make sure you build that into the timeline. Another expectation in this grant, SAMHSA, like all DHH agencies, is required to continuously assess the impact of their policies and programs on health disparities. So another expectation of this grant program is that grantees will be expected to develop a behavioral health disparities impact statement upon grant approval. So if your application is awarded funding, Grantees will also have to ensure that their statement includes policies and procedures that adhere with the national standards for culturally and linguistically appropriate services in healthcare. For more information on this expectation, please see Appendix G, which is in Part 2 of your RFA, and our office, after, during post-award, will be providing program-specific guidance to help grantees with this effort. So now let's review some of the budget requirements. As noted earlier, you can apply for up to $102,000 for this grant, which includes both direct and indirect costs for each budget year of the total 3-year grant program. Direct costs are those incurred in implementing the grant projects, such as salaries and fringe benefits of your program staff, equipment, supplies, contractual, and travel costs. Indirect costs are often referred to as overhead. This term refers to administrative costs such as electricity and central administrative services that cannot be assigned to specific projects. Again, we'd like to remind you that data collection and evaluation costs cannot exceed 20% of your annual budget. Okay, so I want to take a moment because we get so many questions about this, and let's review indirect cost rates. SAMHSA does not accept a research indirect cost rate. However, there are options to help you determine a non-research indirect cost rate. First, if your college has ever received a federal grant, in most cases it will likely have negotiated an indirect cost rate or a facilities and administrative F&A cost rate with a federal agency. So you may likely already have a non-research indirect cost rate. You just don't know it, so you need to contact your business office for this information. Second, if your university has only one rate for all programs, then you can use that rate. Just be sure for both instances to include a copy of the federally negotiated indirect cost rate agreement with your application. Now, if your campus is in a situation where it does not have a non-research indirect cost or a F&A rate, you can contact the U.S. Department of Health and Human Services. The link here is posted on this website, and you can begin negotiating a rate. If this is the case, all you need to do is just state in your application that you are in the process, you are in this negotiation process. Alternatively, your application can simply state that you plan to negotiate and establish an indirect cost rate with DHHS. And if your application is approved, you can modify your budget to reflect the actual negotiated rate post-award. If you still have questions on indirect cost rates, please contact the SAMHSA Grants Management Specialist, Gwen Simpson. She is your contact person for this RFA on these types of issues. Now we'll review cost sharing, which is another requirement for this program. Grantees must provide matching funds from other non-federal resources, either directly or through donations from public or private entities. You must provide a dollar match for every dollar federal fund by the end of the 3-year project period. Remember, you don't have to necessarily do a one-on-one match for each year. All you need to do is meet the match requirement by the end of the project. So basically, you have 3 years to come up with the total match amount. Non-federal match costs. On this list, we've listed examples of allowable costs that you can use toward your non-federal match contributions. Rental space costs that you use for purposes of trainings is a very popular example. The cost for printing suicide prevention awareness and educational brochures is another effective way to meet your match. And I think the most common way, however, that grantees contribute to their match share is the use of personal time and fringe costs. For example, as a match, you could designate a portion of a counseling center clinician's salary based on the percentage of time that he or she plans to be involved in the project and the program directly. Again, this is their time dedicated to the project conducting allowable activities, not their time dedicated to providing clinical services. As mentioned in the first part of this webinar, there are several activities that are prohibited and not allowed in this program, and they're listed on this slide. Remember that your match must be used for allowable activities only. The most common mistake we see in the budget section is when applicants include items listed on this slide as a non-federal match contribution. We cannot emphasize enough, if the activity or cost is not allowed and prohibited under the program, you cannot use that activity or cost as a non-match contribution. Another common question we receive a lot is about the SAMHSA grantee meetings, and just briefly, you are required to attend the SAMHSA grantee meetings. As you determine your budget for this requirement, base your travel costs on 2 meetings only. We will be having a meeting in year 1 and a meeting in year 3. And you can plan to send up to 3 project staff if you'd like, and the meeting will be held in Washington, D.C. if you'd like to help you determine your travel estimate from that location. Again, this is not guaranteed, but this is what we plan to do, as stated in the RFA. Now I'll turn it over to Jen Capella, another colleague in our office.
Hi, everyone. I'm going to talk to you very briefly about your evaluation and data collection requirements. Just for clarification before I jump into this, the terms national outcomes and cross-site evaluation are used interchangeably. I think in your RFA, we've referred to it as the cross-site evaluation and the national outcomes evaluation. They're the same thing. There are 3 different expectations for evaluation. First is the National Outcomes Evaluation, or the cross-site, which addresses core questions about the products and services being developed, the trainings being conducted, the knowledge, awareness, and utilization of suicide prevention activities, and the at-risk students being referred for campus services. The National Outcomes Evaluation, or cross-site contractor, will be responsible for collecting and obtaining data primarily through a web-enabled interface. You, as grantees, should you be funded, will be required to support and facilitate this process, such as completing reports, serving as respondents, identifying appropriate respondents, and entering and submitting your data when it's due. The second requirement is it's called the Common Data Platform. It's SAMHSA's web-based program, and it's used to assess and monitor the extent of your the extent to which your project is meeting its goals. The Common Data Platform, or the CDP, is not necessarily an evaluation. It's really used for performance measurement about how well your grant is reaching its goals. You'll receive training and technical assistance on both the National Outcome Evaluation and the CDP. Finally, we ask that you do a local performance assessment. This is in the form of progress reports. We're going to ask you to determine if you're achieving your goals and objectives that you intended on when you wrote your original proposal, and whether you need to make any adjustments to your project. You'll report on your progress achieved, barriers encountered, and efforts to overcome these barriers. You can use the data you collect to help answer the questions, to answer these outcome and process questions which are listed in the RFA. Also, you may have already have tools in place, and if so, we would ask that you share these materials with us in your proposal. Again, I want to emphasize that only 20% of your total budget can be allocated to data collection, performance measurement, and performance assessment. Based on our experience, it takes a lot of work and time to meet these requirements, so we really urge you to include adequate personnel time and resources into the grant proposal in order to meet these requirements.
Okay, thank you, Jen. So I know we've covered a lot of material, and we'd like to just pause and open up the lines for questions and answers on the information that we've presented so far, such as eligibility requirements, budget, allowable and non-allowable costs, Operator, could you please help us open up the lines for questions and answers?
Absolutely, and at this time, if you'd like to ask a question, please press star 1 on your touch-tone phone. Be sure to unmute your line and record your first and last name clearly when prompted. Once again, if you'd like to ask a question, please press star 1. One moment to see if we have any come up in queue. And we do have a question in queue. The first one comes from Kathy Yarmo. Your line is now open.
Thank you. Question, what are no curriculum fees?
Okay, thanks.
Say that again?
What are no curriculum fees?
Sorry, but where are you seeing that?
Is that a typo?
It talked about curriculum fees that were not allowed in the unallowable areas of your budget. You are not to insert curriculum fees. I was just wondering, I think that might be an academic term.
Yeah, it's curriculum fees. We see it all the time from campuses. I don't know what it is, but we don't approve it. I'm sorry. We just don't approve it. It's a very common terminology, and it's, again, it's not allowed.
I'll check with our faculty partners.
Okay.
Thank you.
Sure.
Okay, our next question comes from Sean Maldoz. Your line is now open.
Hi, this is Sean. Thanks for all the helpful information. I have a quick question. For applicants at universities where there's a relatively low percentage of students from some of the underrepresented groups identified, I'm just kind of wondering how to speak about the low percentages within the grant itself, and is it ever okay to kind of have some of the programs be focused not just on students but also community members that also participate in the university?
What would that look like when you're saying community members participating in the university?
Well, maybe family members or other significant others of students. So like a program that just wasn't focused on students, but it could be invited to the broader community.
Well, I mean, that would certainly be fine. And in fact, one of the allowable activities, had to do with providing information. And we've discovered that family members are often the best gatekeepers. They're the ones who know most what's going on with the student.
Right.
As far as your question, though, the first question you had about high-risk populations that may not exist in large number on your campus, I mean, I guess, frankly, we would just assume that your programming would be culturally sensitive and would touch some of those groups without necessarily having to specifically identify them if they're, very, very small portion of the student body. But, the idea is to, again, you're going to be telling us if you're going to be targeting specific groups, you're going to be targeting the entire campus. That's really going to be up to you.
Okay. That's very helpful. Thank you.
Thank you. And our next question comes from Carla Howell. Your line is now open.
Question has been answered already. Thank you.
Oh, okay.
Thank you. And our next question comes from Daphne Walker-Thought. Your line is now open.
Hello. I have a question about something that was stated on page 5 of Part 1 of the RFP, where it indicated that we must partner with the state Garrett Lee Smith grantee and the drug-free communities grantees who are working with colleges and universities. Does that mean that we have to have an actual letter of commitment from these entities?
No, not necessarily. If you are working with them, that would be great. I think the idea is that the message that we deliver, of course, is that suicide prevention has to be a lot of people's responsibility. And if you're lucky enough to have a state that has a Garrett Lee Smith youth suicide program, so that's for youth ages 10 to 24. They're supposed to use some of their funds for campuses, so we always encourage our grantees to go after them and kind of see what's what and what they might be able to do together. And certainly substance use is seen as a risk factor in suicide, and so it makes a lot of sense to be working with groups in the community who have similar goals.
Okay, thank you very much.
Okay, and our next question does come from Robin Thagyon. Your line is now open.
Thank you. Our university does not have a negotiated indirect rate. Did I understand correctly that we can state in our budget that we plan to negotiate an indirect rate? And then, second question, do we go ahead and budget that indirect rate, the one that we have calculated, in our grant proposal budget?
I think that would be a question you might want to direct to Gwen Simpson. You know, we're the programmatic experts, and there are some things over the years that we've learned about the budget, but there's some questions that I don't know that we can answer. But I believe in the RFA there is very particular guidance on who to contact and how to go about kind of beginning to work on your indirect rate.
Great. Thank you very much.
Okay, thank you. And our next question does come from Kristen Aslin. Your line is now open.
Hi there. I just had a question about the guidance for Attachment 4 regarding the letter to the SSA. As an institution of higher education, is that required?
Yes. Yes. Yes.
We're going to look at the frequently asked questions document. Do you have that?
I do have it, and I didn't. Maybe I missed it, but I didn't see any guidance there, but it may be.
Well, that's what we're looking at now. In case you need to refer to it later, we're going to look at that together right now on the call. Because it is a popular question.
Okay. So if your state has a state single point of contact, which not many states do, and there's a link in the RFA for that, then that's all you have to do is write to them. But then if you don't have one of those, then you need to fill out, you need to go to the thesis statement to your, and send it to your single state authority.
Okay, and that's the Department of Behavioral Health usually, right?
Well, yeah, again, there's a link. So
there's a link there. Okay.
There's a link in the RFA, and there's a link in the frequently asked questions.
Okay, thank you.
Thank you.
Appendix C also, there are specific detailed instructions that walk you through this process in Appendix C.
Perfect, thank you.
Thank you. And as a reminder, if you'd like to ask a question, please press *1 at this time. And our next question does come from Angela Darish. Your line is now open.
Hi. I was just wondering, on page 11 of the RFA, it talks about matching funds and that you can apply for a waiver if an extraordinary need is met. And so I'm just wondering what would justify an extraordinary need.
Hi. Again, that is a very good question. And since it deals with the financial, business-related issue, we strongly recommend you contact Gwen Simpson, who is your designated grants management specialist, who has a responsibility to provide you with guidance on questions like that.
Okay.
Okay?
Thank you. Thank you.
Yeah, I have to say, I'd like to just add that we've not seen any document that actually specifies, what makes, a very dire situation. So I think it's probably a lot of that's your presentation. But so we're not like avoiding answering you, but really we've not seen anything, and I don't know that anything specifically exists like that. Like Gwen would be the best person to ask.
Well, there was one grantee that was granted a waiver, and so they had been granted a waiver previously for another grant at the U.S. Department of Education. So they had a precedent, and they also, they demonstrated a need for it. So it happens, but not often.
Okay, thank you. And our next question comes from Gary Saxena. Your line is now open.
Hi, thank you. I noticed one of the allowable activities was around promoting the suicide hotline and the lifeline. I'm wondering if there's any interest or evidence around also promoting non-phone-based crisis lines, such as the, I believe it's called the crisis text line, or texting and SMS-based hotlines that are also, I think, becoming more popular, and there's more exposure to them, and some evidence to suggest that they might be more useful for a younger generation that prefers to text versus call. So I'm just wondering what SAMHSA's stance is on that.
Well, there's a crisis text line that's part of the National Suicide Prevention Lifeline, so we definitely support it. I think that probably you've raised our awareness, and we need to just add it in the list of allowable activities, but absolutely.
Okay, I don't believe that it's part of the National Suicide Prevention Lifeline. I think they have a chat-based service that's available not 24 hours a day, but from 2 p.m. to 2 a.m. or something like that. The crisis text line is something else that's been started by a separate organization, and so I'm not sure if the Suicide Prevention Lifeline will be starting something similar, or if the focus is really to promote that service and not so much other hotline-type services that aren't affiliated with that one.
Well, I think I know what chat line service you're referring to, and I think, you know, when you get to the point if your grant is approved and if you're thinking about, you know, developing sort of a marketing communications plan and promoting different types of resources, we want to make sure that your plan is, you know, consistent, and it could be a hybrid approach, but we want to make sure your messaging is consistent and not confusing to your population. So whatever approach you do decide to do, whatever's feasible that you think is most effective, there could be a couple different approaches that work best for your community, and, you know, we can work with you during the life of the grant on how to integrate any kind of suicide prevention lifeline, you know, initiatives. But you're not limited to that.
No, we ask, though, that your programming be evidence-based and that you're supporting programs that are reputable and you know, and that we recognize them as reputable programs. So yeah, I would definitely talk to your project officer once funded about that.
Okay, thank you so much.
All right, thank you. And our next question comes from Sherry Correll. Your line is now open.
Yes, good afternoon. I'm wondering if our university does have an indirect rate that we have with different agencies, and I'm wondering if we could get the office to waive the indirect rate, if that could be used as part of the match.
You know, I know that Gwen Simpson would know the answer to that in a second, because I've actually heard that come up in like years past, but I don't know the answer. We do not know the answer to that. So can you please, and you know, in the RFA, there's both her phone number as well as her email, and she responds right away.
Okay, thank you very much.
Okay, and our next question comes from Abby. Abby, your line is now open.
Hi, thank you. Our state does have an SPOC, and we've contacted them, but they've informed us that they did not select this program for review. In that case, do we do a PHFIS?
Yeah, that's what happened with another, there was a question that came through the phone that I took, and yes, then you have to do that. But I think frankly, it's no big deal, and honestly, we don't know it. I mean, it's just writing, just showing them that you're applying for this grant.
Okay, thank you. That kind of helps our anxiety about that. And also on the HHS checklist, I believe that's where it is, there's a question about our nonprofit status. And there's not an NA spot or a place to say that we're an educational institution. I believe it's Part D on the HHS checklist. What do you recommend we mark?
I think you might want to ask Gwen about that.
Okay.
Yeah. I think these types of questions that are related to forms, completing forms, sort of the financial related questions or identifiers and numbers, Gwen Simpson is really the most appropriate point of contact. We're the program office, and we work directly with them, and they're there to assist you in those types of questions.
Okay, thank you.
All right, thank you. One more question here. Let me gather that name for you. Okay, and our next question comes from Carolyn Moore. Your line is now open.
Thank you and hello. My question is, if we don't have clear-cut numbers regarding the number of students who have a history of suicide, but would like to include that as part of our infrastructure building, how will that be seen by the grant reviewers?
I think that is absolutely fine. I mean, the idea is that by asking the question, and in fact that question gets even asked in our national outcomes evaluation as well, it really delivers the message that schools need to figure out a way to try to capture that. But many schools, have challenges in this area, with campus police collecting some things, and the counseling center collecting some things, and the local police collecting some things, and the coroner collecting something different, and it's really, and so it's kind of like delivering a message that it would be really important for everyone to kind of be able to work together to figure out as best as possible how to keep track of this. So no, there's no ding for not having that, but really the message is that we would want to encourage, every campus to work on trying to figure out how to collect that kind of information.
Thank you very much.
Thank you, and currently I'm showing no additional questions at this time.
Okay, thank you so much, and we're going to continue now with the next section of our presentation, which will cover the application review criteria, and I will turn it over to Jen.
Hi, everybody. This is Jennifer again. So I'm going to talk to you about your project narrative. The project narrative is really the most important section of your application because it lays out why you want this grant, what you intend to do with it. There are 4 different sections of the project narrative that you must complete, and I'll walk through each of these with you. The first is the statement of need. The second is the proposed approach. Third is your staffing and management plan, and the fourth is your data collection and management plan. You must use these 4 section headings in the development of your project narrative. Your application will be scored according to how well you address the requirements for each section of the narrative as listed above. The number of points after each heading is the maximum number of points a reviewer may assign to that section of your project narrative. The scoring weights are not necessarily assigned to individual bullets, but each bullet in the RFA is assessed in determining your overall score. So it's really important that you respond to each bullet item. It's also important that you remember that this section does not, the entire section of the project narrative does not exceed 25 pages. If you exceed 25 pages, your application will be screened out and returned to you and will not be considered for review. Also, if you place information in the incorrect section, your application will not be considered for review, so keep a close eye on your formatting. So I'm going to go through each section now with you and highlight key requirements that you must meet for each section. Please understand that I'm unable to review each bullet item with you, so remember to read the section very carefully and respond to each item that's requested in that section. Section A is the statement of need, where you're going to provide an overall description of your campus and demographic information on the populations to be served. In addition, include the number of student deaths by suicide in the past 5 years, if you know it, available information on suicide attempts, emergency room visits, and hospitalization related to suicide ideation or attempts. Describe your current suicide prevention services, programs, and resources, if available, on and off your campus. Please also be sure to describe the service gaps, barriers, and other problems related to the need for infrastructure development for suicide prevention on your campus. If you have a suicide prevention plan, or suicide prevention under a crisis response plan, please include it in attachment 5. If you do not currently have a suicide prevention or crisis response plan, then please state so clearly, and let us know if you intend to write one once you are funded, which we anticipate that you will. Identify sources of data provided to develop the statement of need and provide documentation of a need that may come in a variety of qualitative and quantitative sources such as the National College Health Assessment. Section B is the proposed approach. It's the largest section of your application, and this is where you're going to provide the most detail about your program. It also has one of the highest review criterion, so please be conscientious when responding to this section. The proposed approach should be based on the information that you provided in the statement of need. It's important that this section is integrated and consistent with all other sections of your application. The first bulleted item in this section asks you to describe the purpose of your project, including a clear statement of its goals and objectives. These must clearly relate to the performance measures you identify in Section D, data collection and performance measurement. If you say something once and need to say it again in another section, that's okay. It's better to be redundant than to not include information where necessary. So for each of these activities you request for funding, you must describe the problem the activity aims to address, the goals or outcomes expected, and how the activities will be implemented to achieve the desired goals or outcomes. To achieve the desired goals or outcomes. Please note that you do not need to use grant funds to pay for all of the allowable activities as described earlier. You also must describe how the needs of the youth at high risk identified by the National Action Alliance for Suicide Prevention will be addressed. These populations include, but are not limited to, lesbian, gay, bisexual, or transgender youth, American Indian or Alaskan Natives, military family members, and veterans. And please be sure to describe a plan to address the needs of each high-risk youth population you identify in your statement of needs. A common mistake we see in applications is that an applicant will describe the needs of a high-risk population, but they won't include a specific plan on how those needs will be addressed. Make sure that you provide leadership and organization on how you will partner with other organizations related to the programs, to your program on and off campus. Lastly, submit a charter graph depicting a realistic timeline for the entire project period showing key activities, milestones, and responsible staff. This program management timeline should be part of the project narrative. Do not place it in the attachment. When you're writing your timeline, please also be aware that it is critical that your college or your university has the infrastructure to respond to students seeking services before you start implementing training programs and your awareness campaigning. You don't want an influx of students coming to your counseling center if your counseling center can't handle that number of clients. The next section is Section C. It covers staff management and experience. So in this section, we ask that you provide a complete list of your staff positions for the project, including the project director and other key personnel, showing the role and responsibility for each position and their level of effort and qualifications. The section must also be consistent with the personnel section in your budget. A common mistake we find in applications is that when an applicant describes a staff position in this section but then does not identify that position in the budget section, whether it's your federal budget or your match budget. Also, please remember that biographical sketches and job descriptions should go in Appendix E of your application, not in this section. It does not count towards your 25 pages. So the last section of the project narrative is the performance assessment and data collection. It also has a high number of review points. In this section, you need to document your ability to collect and report on the required performance measures as specified in Section 1.2.2 of the RFA. Describe your plan for data collection, management, and analysis and reporting. Specify and justify any additional measures you plan to use for your grant project. You must also describe how data will be used to manage the project and assure continuous quality improvement, including consideration of disparate outcomes for different racial or ethnic groups. Please also remember to describe how information related to process and outcomes will be routinely communicated to program staff. You also need to describe your plan for conducting the local performance assessment as specified in Section 1.2.4 of the RFA and document your ability to conduct that assessment. Finally, you must explicitly state your willingness to work and collaborate with SAMHSA's evaluation technical advisors, specifically a statement that you will work with and collaborate with the Suicide Prevention National Outcomes Evaluation, and that you will comply with all of CMHS's necessary GIPRA requirements, including submitting your GIPRA data via the new web-based Common Data Platform System, the CDP. Finally, describe how you'll monitor deaths by suicide and suicide attempts and how you use this information to further information on your project. We recommend that you carefully assess your resources to ensure that you request adequate staff support to meet the data collection and evaluation requirements. But like we said earlier, please note that you cannot spend more than 25% of your total grant award for data collection and performance.
Your application must include a budget for each project year. It is highly recommended that you use the SAMHSA budget format in Appendix F when creating your budget. This will help expedite the review of your application. So there are two components of the budget. One is the budget table, which outlines the budget cost breakdown. Two is the narrative justification. Each individual budget line item must include a detailed narrative justification detailing how you arrived at the total requested amount. Here's some common mistakes that we see in budgets include the lack of a budget justification narrative. For example, a budget might include $9,000 for contractor costs, but it fails to include information on who and what type of services the contractor is rendering, including the hourly fee and rate. Another common mistake we see are mathematical errors too. So we really recommend that you have someone proofread the budget section so that all of your budget line items and cost categories add up to the total budget for each respective grant year. Okay. Sections E, for the section, there's also section E and F as part of your supporting documentation. So, let me just go back here. As a reminder, sections A and D, which was just reviewed, must not exceed 25 pages. For your supporting documentation, even though points are not associated with these sections, the reviewers will be asked to comment on the appropriateness of this section after the merits of your application have been considered. So include your biographical sketches for the project director and other key positions in section E. And then in section F, you need to provide the confidentiality and SAMHSA participant protection human subjects information. There is no page limit for these sections. So now we review the section E, which is a very comprehensive section of your application. Because of the confidential nature of some of the work that you may be involved with, it's important to have safeguards protecting individuals from risks associated with their participation in SAMHSA projects. So if you go to Appendix 1 of Part 1 of the RFA, you're going to find guidelines of how to complete this section of your application. Please note there are a total of 7 elements that you must respond to in this section. Again, even though points are not associated with this section, it's very important that you respond to every individual budget item contained in each of the 7 elements. Also, be sure to place the correct information under the appropriate bullet item. Many applicants make the mistake of putting information under the wrong heading, which adversely affects the review process. In addition, this section contains specific websites and SAMHSA offices that can provide information on protection of human subjects regulations and the IRB compliance process. Okay, so that concludes our presentation on the evaluation criteria. At this time, I'm going to open up the line for questions and answers. Operator, can you please help us with this?
Absolutely. And once again, if you'd like to ask any questions, please press *1 at this time. Be sure to unmute your line and record your first and last name clearly when prompted. Once again, if you do have any questions at this time, please press *1. One moment to see if we have any come up in queue. And we do have a question in queue. The first question comes from Abby. Your line is now open.
Hi, I have a question regarding adequate consent procedures. Our project is primarily outreach-based, and so, for example, we may be giving a presentation in a classroom or reaching the entire student body at a campus fair. These are examples of our activities. In the way I conceptualize it, it doesn't make sense to me to present outreach participants with forms for formal consent. Am I off? Am I missing something, or is this an okay assumption?
Well, that's, yes, very much so. I mean, correct. You would never be passing out consent for an outreach activity.
Okay, great. Thank you.
Thank you. And our next question comes from Sarah Bellstock. Your line is now open.
Hi, I have two quick questions. One, is there an opportunity?
Could you talk louder? I'm sorry, we can hardly hear you.
Yeah, I have two quick questions. One is there an opportunity to include references somewhere? I did not see that.
No, not this year. They've been removed. They really just want letters of commitment, not even letters of support.
Oh, sorry. I mean references as in literature citations.
Oh. Well,
I know in past years it's been one of the appendices or one of the.
And that was removed from this year's RFA. So no, you don't have to.
Okay.
And you shouldn't, because that's going to add more than you have to. If you want to keep it on hand for internal purposes, you can, but you don't have to submit that in the application.
Okay. And then, is there a specific place where we should be addressing sustainability?
I'd say throughout.
Okay.
I mean, definitely you can speak to it. I mean, we really want to know what your program is, but we'll start talking about sustainability as soon as you're funded. So
okay.
If you already have plans, then we welcome you. If you could fit it into 25 pages along with, adequate information about your proposed approach and your need and that, then yeah, if you can include it.
Well, I think it would also reflect a very strategic approach to suicide prevention on your campus, that it's not just about what you're going to do, but it's how you're going to embed it, into the campus culture and structure, and hopefully be able to continue it. 3 years go very quickly, unfortunately.
Okay, thank you. And it looks like our next question comes from Cindy Lube. Your line is now open.
Hi, I have a quick question regarding Section C on key staff. And not all staff associated with the project in our match would be considered key. And can we add a section there that says, other staff?
When you say other section,
Or
I think
other staff?
There's a section that's called Staff Management Relevant Experience.
Right.
We want to have a list of all staff positions.
Well, yeah, but it says key personnel, and there's other personnel related on our match, for instance, that serve on committees and might only be dedicating. We might only be showing 2% of their time. We wouldn't consider them key. So that we would consider that other personnel, and therefore we wouldn't need also like their job descriptions and all in the attachments. Would you agree with that?
What are you referring to? I'm just making sure we cross-reference this with. What page are you referring to in the
I'm referring to Section C in the narrative on page 16, which deals with the complete list of staff positions, including the key personnel, and then the appendix where we have to include the bios and the staff positions for the key personnel. And what I'm verifying is that not all staff are necessarily key, and you're really only wanting the bios and the job descriptions for the key personnel.
That is correct. But,
okay.
But we have seen on many applications where people additionally will list, some of the match, professors or department heads or whatever.
Right.
Percentage of time, right, but they're not key at all.
They're not key, so we wouldn't have to provide their bios and job descriptions.
I think that's a very good assumption.
Okay, that's what we wanted to verify. Thank you.
Thank you. And our next question comes from Stephanie. Your line is now open.
Thank you very much. Just a quick question on looking at the first part, I think on page 13 on Section A, the bullets of the populations that we're going to try to engage, and we have some of the activities through. Will some of the performance points be based on the fact that we should be able to address each bullet point from language, sexual identity all the way down, or can we do what we have that's best and that will best represent us?
Under the demographics, are you saying?
Yeah, well, number one, where it says describe your institution on the location, size. The language, it says we could use sexual identity, disability, veterans. We have a strong veterans population, and I'm not sure how many we have in terms of American Indian and Alaska Natives. I was trying to find out, when we look at performance points, the more of those things that we address, will the performance points be based on the more of those things we address, or shall we pick out 2 or 3 significant populations out of those populations there?
I think speak to the populations that are relevant to your campus. It doesn't hurt to mention other populations and that you will meet the needs of those populations on your campus. But if you have a strong presence of veterans on your campus, then definitely speak more to that.
Okay.
I think it should reflect the needs of your campus.
Okay.
Yeah, I think these are, we're trying to give you a framework to work with in terms of reporting out and describing your demographics. Mm-hmm. I just also want you to be careful that I think it's hard to get information. It might be more challenging to get information on gender identity. And
right.
That
was my concern.
Yeah, these are groups that are hidden, so I think it's good for, in terms of your proposal in this section to say, we don't know. But part of our effort is to find out and do some outreach and to reach out to these groups, because these groups are vulnerable and are considered high risk for suicide prevention. And one of the challenges is, you may not know who they are on your campus, and maybe you'd like to use this grant to help support that effort.
Okay.
And it's okay if you don't know the exact numbers, but that you're aware that this is a high-risk population, where we're going to do what we can, and this is our plan.
All right.
Does that make sense?
It makes a lot of sense.
And then some of you are out where there might be 0 American Indians or Native populations, and you really know all of your demographics, and you should just state that. And this is a section where you can state we have 90% black, 30% white, and student veterans are big, et cetera, but 0 American Indians, Alaska Natives. And so then that means, there won't be any programming for those populations. We want to know that you know your campus and then what your needs are, that you really understand your campus. And then for those groups like LGBTQ, we know that that's more of a challenge. And that you could say you're going to be working with the LGBTQ offices or the disability offices to get a better sense of those populations and really tailor those needs and those programs for those needs. Does that make sense?
It makes a lot of sense. Thank you very much.
All right, and our next question comes up. We do have another question from Cindy Lube. Your line is reopened.
Hi. My question is with regards to the budget and the justification. And for year one, we've got the detailed chart for each section of the budget and then the justification. And then for years 2 and 3, it's summarized at the end. Did I understand correctly that we actually need to have the detailed budget for years 2 and 3 as well in the budget justification and not just summarized at the end?
We're looking here for the answer just to make sure. We're just looking so we're not because every year it changes.
Yeah, it's in Appendix F that starts on page 25.
Yep, we're looking at that now.
Okay.
And
all of the examples do show just the year one, and then when we get to the end of it on page 37, it shows the summary that includes the future years. And so that's how we've prepared it, but I just want to make sure that we've prepared it correctly.
You know, I think that it would be best to confirm that with Gwen Simpson, because I have some memory of I think sometimes that Grants Management Office going back to prospective applicants and asking them to complete things in more detail. But, you know, we're not always privy to all that information. So I think that would be worth a call to Gwen Simpson about that.
All righty. Thank you.
All right, thank you. And we do have a follow-up question from Abby. Your line is now open.
Hi, I hope this is an okay time to ask. I have a question about the timeline and basically the start of the program. I saw in the frequently asked questions, the bottom of page 8, for the purposes of the timeline and work plan, just consider October 1st, 2014 as the start date. We were reading that to be, now it would be October 1st, 2015. And the follow-up question is that because we're on a college campus, it's so hard for us to do any kind of planning, budget-wise, staffing-wise, or program-wise, without really considering the semesters. And so just kind of your thoughts on, for us, a workable time would be fall semester and then spring semester. I guess just wanting to know your thoughts.
I do apologize. You're absolutely right. Those need to be, and I'm so glad you figured that out. So, again, just figure October 1st for the start of the project. And what you describe is an issue that all of our campuses face. And if you want to call it, you know, fall semester and spring semester, that would be fine. I mean, often, you know, campuses feel like they really can't get started with their programming until the spring when the new semester begins. So, you know, whatever works best for you. But you're right that it's complicated because the grant starts for some campuses in what is almost the middle of the semester.
But you know, once grant funding is released, it's expected that you're going to begin your work. So that might mean that you're looking to hire, or that you're starting your strategic plans, or you're starting discussion about your crisis protocols, or you're laying the foundation for the work that you proposed to establish the work that you proposed in your application.
Can I ask a follow-up question? We received the advice that it's good to balance our spending semester by semester. However, if we're, for example, just getting started October 1st, we may not be able to hire all of our staffing, and we may not be spending as much in the fall as we would be spending in the spring.
Absolutely. Yep. And that's very common with all of the SAMHSA grant programs. You get the notice of grant award. It's very common that you're going to have grant terms and conditions to respond to, and a lot of administrative work to do in the beginning, and recruitment and hiring and strategic planning and training. There's a lot of training and jump start activities. In fact, we get a little concerned when grantees just pound the pavement on day one and they start training and they start doing everything, we want you to just take a moment. We're going to be, there's lots of trainings, orientations. We want you to look at your program plan again, think about strategic planning. Maybe there were some things that you may have submitted in your application and you're learning some new ideas and you want to tweak things a little bit in terms of starting up and executing some of your projects. And so we understand that there's planning time in those first 6 months of the grant award.
Okay, great. So it's okay if we're not spending at least half.
Right, and that should reflect your spending. Your pace of your activity should be reflecting your spending activities. So we understand that maybe the first year there's not a lot of spending, but we definitely think that you should have a good even spending after that and a really robust program.
Great, we hope so too.
Forward, yeah. But we know that we totally understand, and that's very common.
Okay, thanks.
Okay, thank you. And our next question comes from Jessica Miller. Your line is now open.
Thank you very much. I have two questions. One is related to the attachments 2 and 3, the data collection instruments, interview protocols, and sample consent forms. And what, could you give some clarification on what you're expecting for that with us not providing as many direct services and more outreach and those types of activities?
Could you please name the page that you're looking at?
Oh, I'm looking at page 12 in the part 1.
Thank you.
Oh, attachment 2, data collection instruments?
And attachment 3, both of those, yes.
Mm-hmm. Sample consent forms. I
think that's if you're doing research. You know, some schools are collecting information. And we're not talking about clinical information, but you know, they're running studies or things like that. So if you have those materials, send them along. If you don't, then don't worry about it.
Okay, so if we aren't doing like research type activities, then we wouldn't need to include those attachments, or we still would, or?
No, I mean, you don't have to develop them especially for it's just to see what you have if you've got things going on.
I see. So if you have things going on that aren't connected to the grant, then you can attach those types of instruments.
If you're doing some sort of programming that requires that people provide consent, that you send that along.
Okay, and so if we don't have that, then we would just put not applicable without attachment, or?
Absolutely.
Okay. And then my other question is regarding Section B in the narrative. Numbers 1 and 2 both kind of talk about goals and objectives. This is on page 15. And I was just kind of wanting to find out how you're differentiating between those two sections.
Did you say under the proposed approach?
Yes.
Under the proposed approach?
Right. Section B, proposed approach, on page 15, there's item number 1 that where you would like a clear statement of goals and objectives. And then in item 2, for each activity, you also want goals and measurable outcomes. And so I kind of was hoping there might be some guidance on how we differentiate those sections.
Well, I think number 1 is just sort of an overall description of the whole mission, objectives of your grant. And then when you get to, you're going to break it down based on those allowable activities. Okay, we have a problem. We have no, we have no infrastructure, and we have no crisis protocol. That could be one of your major goals in the grant, and then you're going to break down how you're going to meet that goal in number 2. And then you might have a goal in terms of awareness and education for students. That might be one of your goals. You're going to broadly state it in number 1. Our goal is to, increase education on suicide prevention among our staff and faculty. You know, that's a measurable goal. Number 2 is you're going to tell us how you're going to do it. Our goal is to increase, you know, suicide prevention education and awareness among staff, faculty, and families. And number 2, you're going to explain in detail how you're going to do that.
I see. Okay.
Makes sense?
Well, great. Thank you very much. I appreciate the clarification.
Thank you. And our next question comes from Gary Saxena. Your line is now open.
Hi, thanks. My question is about the at-risk groups. I know that there are the 3 ones that you highlight. Is it recommended or not recommended to also include information about other at-risk groups that we might want to focus on if our grant were to be funded? Or do you recommend that we focus just on one of those 3 or a combination of those 3 rather than adding information about other at-risk groups on our campus as well?
I don't know. I think that I can't put my finger on it, but it definitely talks about, or any other at-risk groups that you identify. You know, graduate students, international students, med students. You know, first-year college attendees. I mean, whatever. It's really based on what's going on your campus.
Okay.
What you're identifying.
Okay, but we should also include at least one of the 3 at-risk groups as well?
I don't know if we'd say one. There's no limit or limit on it.
But at least one of them. I mean, you would recommend that we wouldn't just include other groups that aren't one of those 3.
Yeah, I mean, if you don't have student veterans on your campus, you should just state that.
Right.
In one sentence. We want you to really have a sense of your institution, what the demographics are and what the needs are. So there's no limit here in terms of how you're going to describe the needs of your institution in terms of high-risk populations. We know in California there's a few applications where the Hmong community, there's a very high percentage of Hmong students, you know, and that was, you know, on that campus. And then maybe there's other campuses that have a very large number of, and they're focusing on graduate students, medical students, because the needs, they're considered very, you know, they have some special needs in terms of outreach and messaging. So we're not asking you to check the box and hit all of these groups. This gives you a framework, and our experience has been these are very high-risk groups that need some attention. And if you don't have those groups on your campus, then just state that as such and provide details about what your campus is like in terms of the demographics. I think that's what this program is all about, meeting the needs of your campus and the folks who are there.
And it's also okay to focus on the general student population.
Right. Oh, yeah, and the general student population. Right.
Okay, great. Thank you so much.
All right, thank you. And our next question comes from Amy Boyd Austin. Your line is now open.
Thank you, and I will just say that the question has already been answered.
Okay, thank you. And we do have a follow-up question from Carolyn Moore. Your line is now open.
Thank you. I've heard you answer the question in regards to not needing to use confidentiality forms when you're basically doing outreach. We are also intending to add some mental health and substance abuse screenings during our outreach. Will it be necessary to use any kind of consent or confidentiality forms for screenings?
I think, you know, there's certain protocols that I believe these different kind of screening programs have. So you would just follow whatever, you know, there's like National Depression Screening Day, and you know, so whatever is recommended in terms of how to manage it. I mean, whether just by virtue of the fact that the person sits down and says, I'm going to participate, if that is like the...
Yeah, that's usually sufficient. We usually don't do any forms associated with that other than what they complete.
We don't require any additional kinds of consent.
Okay, thank you.
And currently I'm showing no additional questions at this time.
Okay, well, thank you for those good questions. And now we're going to move on to the application submission process. Real briefly, we're going to talk we're just going to highlight some key administrative submission procedural information contained in Part 2 of the RFA. Real briefly.
So this is Jennifer Capella. There are 10 required components to your application found in Part 2 of the RFA in Section 1.3. There's also a checklist for format requirements in Appendix A. For example, pages must be typed in black, single space, using font of Times New Roman 12, with all margins at least 1 inch margins. Make sure you follow these requirements, please. As mentioned earlier, the project narrative section cannot exceed 25 pages. And there are several other format requirements, so please carefully review Appendix A for your requirement checklist. We strongly recommend that you make sure that all 10 components and formatting requirements are completed by using this checklist. Your application will be automatically screened out and not reviewed if you do not follow the formatting instructions or if you miss any of those 10 components. Applications are due by 11:59 p.m. Eastern Standard Time on April 20th. Applications must be submitted electronically through www.grants.gov. SAMHSA will not accept paper applications, so make sure you get into your account on grants.gov prior to the date of submission. We don't recommend that you log on to grants.gov for the first time when you're trying to submit your application. That is not a good idea. So for more details on electronic submission procedures, please refer to Appendix B. And like I said, the sooner you can get on grants.gov and kind of poke through it, the better. You don't want to find yourself in a pinch at the last minute and not get your application in on time.
And yes, we just wanted to list here, this is consistent with the RFA. In Part 2, you will find this information. We just wanted to highlight it in today's webinar, that if you're having any problems and submitting your applications electronically, there are resources available to help you. Okay. And also, I think we mentioned her name a lot because she is an expert and the authorized official to provide you with information, guidance, clarification on downloading forms, the website, submission procedures, indirect costs, anything related to the budget. Gwen Simpson is the person you need to contact. Also, we just wanted to remind you that in Appendix 2, there are really wonderful resources in Part 2 of the RFA to help you develop the content of your program and your overall application, so please check those out. And again, the final reminder, this webinar will be, the recording of this webinar will be posted in the next few days on the SPRC website, and it will be available through April 20th. So I'm just going to open up the lines again for any final last questions that we might have before concluding today's webinar. Operator, can you kindly help us?
All right, I was definitely on mute. And once again, if you do have questions, please press *1. Be sure to unmute your line and record your first and last name clearly when prompted. Once again, if you have any questions, please press *1. One moment to see if we have any come up in queue.
This is not a chat feature.
We do have a question in queue from Beverly Andrews. Your line is now open.
Good afternoon. I have a question about the reference to e-grant application on page 15 in the second section. It was a little confusing because it talks about submitting under grants.gov, but then it refers to some extensions that relate to e-grants applications. So I'm not really sure what some of those extensions mean and how to upload them in PNF or a BNF type file.
Grants.gov has a help desk. So when that's why I said to log on to grants.gov as soon as you can, poke around, see, kind of look at the system. And questions like this, I would definitely contact the grants.gov help desk because they're going to be, they'll be able to help you.
And also, Gwen knows a lot about submitting applications. I'm
assuming that the forms in I've uploaded a lot of grants in grants.gov before, so I'm assuming that the forms in grants.gov have these extensions, and I don't need to create those extensions, and I just create my PDFs and upload them. That's what it sounds like, but I'm not sure.
No idea.
Sorry,
thank God we're not involved in any. There's a whole group of people just dedicated to this process. Thank God, because we don't know the answer. That's why we put it on the slide. That's why you have Roz Blozier as the contact person, and she's been taking a lot of your calls and taking all of those programmatic questions, and then anything she doesn't know, she's working with Gwen Simpson on those business-related application submission type questions. Those are really good questions. We just don't have responsibility in answering those questions.
Thank you.
I'm sorry. But please, don't hesitate to contact those resources and Gwen Simpson. Any other questions?
Yes, there was a follow-up from Kristen Aslan. Your line is reopened.
Thank you. I just had a quick question. In going back to the narrative, under proposed approach, section B, page 16 of part 1, it talks about demonstrating the commitment of campus-based administration and including letters of commitment in attachments. So we're a community college, and our leadership is pretty finite. We don't have lots of different schools and deans, and different campus-based resources are, report to either one of 3 VPs or our president. And so if we had one letter committing from the top leadership with all their signatures, would that be appropriate?
Yeah, whatever you can do to demonstrate what the role is there in terms of your leadership and their support and your project is what's important. And we understand community colleges and their limited resources and the unique circumstances there. I think the most important thing is it's something to think about. That's why we put it in the application. What is the role of leadership in your project? And then who will you be partnering with and those key stakeholders to help support your grant? You can't do it alone. So that's totally acceptable. Whatever you can do that's appropriate, for your campus.
Great. Thank you so much.
All right. Thank you. And I am showing no further questions at this time.
Great. Well, thank you so much. That concludes today's SAMHSA Technical Assistance webinar on the GLS Campus Suicide Prevention Grant application. It's been a long afternoon, and we appreciate your participation and time with us today. Thank you, and have a nice afternoon.
Thank you. This now concludes today's conference. All parties may disconnect. Speakers may hold for post-conference.